Taking a look at your Health Watch, September is Suicide Prevention Month, a time to emphasize that no one should struggle in silence and get those in need the tools, resources, and support to talk openly about preventive ways to recognize warning signs and to get help. So 1 in 20 American adults have serious thoughts of suicide each year. About 1 person dies by suicide in the United States every 11 minutes, and nearly 80% of those are men or boys. Suicide is the second leading cause of death among people ages 11 to 24. This is all according to the National Alliance on Mental Health. So joining me now to talk about this very difficult topic, but something we need to talk about, is Dr. Lindsey Fish with Denver Health. So Dr. Fish, we're always so happy to have you here to talk about some of these hard things because you break it down so nicely. So why does suicide prevention matter so much, not just to the Denver community, but the community at large?
Yeah, so first of all, suicide affects everyone, no matter age, income, background, neighborhood. It really impacts everyone. And having a conversation can foster connection and really prevent things. And so we know as physicians, those of us at Denver Health, that we see the impacts of suicide mental health struggles each and every day for our patients and our family. And as you mentioned, it's a leading cause of death of young people. And unfortunately, here in Colorado, we're one of the highest rates of suicide in the country.
That is just terrible news to hear. So what are some warning signs? This is so hard because people, I think, often look back like, what should I have seen? What could I have done? So what are some of the warning signs that are typically out there?
So the first thing is to remember that having a wish to die or not wanting to live isn't normal. It indicates that somebody's in severe despair. So if somebody starts talking about wanting to die or having hopelessness about the future, that should be concerning. Other signs are withdrawal from friends, family, or no longer being involved in activities or work like they used to be. Big mood changes, changing from, very irritable to suddenly very calm, or despair and really sad should also be a warning sign. And if people start engaging in new risky behaviors that seem different from their norm, that should also be a warning sign. If friends and family and providers can recognize this, we can intervene early.
Okay, that is some good news there. So what are resources that are available to someone right now in crisis in Colorado, or Denver, I should say?
Yeah, so actually there's lots of resources nationally. The first one is to call or text 911, which is our suicide and crisis line, 24/7 resources. The National Alliance of Mental Illness also offers a 24/7 helpline. That number's on your screen, or you can text NAMI and get 24/7 support. There's lots of specialized support resources available as well. So the Trevor Project for LGBTQ+ youth or the Veterans Crisis Line are available to sort of specialized groups of patients.
All right, so how can each of us make a difference during Suicide Prevention Month and then beyond? This is not just 1 month issue.
Yeah, so the first of all is have a conversation. Ask somebody how they're really doing and engage in that. Listen without judgment. Share resources. So on social media, you can post good resources under #Suicide Prevention Month. Use supportive language. We prefer died by suicide as opposed to committed suicide to reduce stigma around that. Advocate for our crisis resources, our community mental health resources. And lastly, you can get trained in something called QPR, which is question, persuade, and refer, or also mental health first aid to really be able to help someone in a crisis.
All right, it's such an important topic, and it's obviously so prevalent, and so many people are suffering. So thank you so much, Dr. Fish, for helping us break down a little bit more of these issues.
My pleasure. Just have the conversation.
And we'll see you next week with another topic.
Sounds great.
So important. Thank you both.